Whenever I sit down with clients and I'm teaching them how to chart their cycles, one of the things that I do always, the first time I meet with somebody, we sit down and we start chatting about their chart, is I do a PMS screening. So PMS is for premenstrual syndrome. I think most of us, especially as women, we're familiar with that term. We know what it means. We know what it is. And somehow it's become a verb, like we're PMSing. But in all reality, PMS is actually a diagnosable thing. It's not just something that we're doomed to live with. We're not doomed to be this irritable monster for a week before we get our period, right? Even though that does happen to some of us. But oftentimes, that's actually a sign of some sort of hormonal imbalance. So the reason that I do this it's the first follow-up. So the first time that I'm sitting with a client, we do a PMS screening because I want to know, are you experiencing these unwanted symptoms? And if so, how can we actually heal that and treat that? Like I said, PMS is actually diagnosable. It's not just something that we are doomed to live with as women. So let's dive in today on what some common symptoms of PMS are and how we can relieve those symptoms. Welcome to the Truth and Fertility Podcast. My name is Haley and I am your host. I work at an OBGYN clinic where I teach women and couples how to chart their cycles so they can either achieve or avoid pregnancy and also to manage their fertility. I have a huge passion to teach women and couples about the beauty of their fertility and how the pill is never the answer to women's health. There's a lot of good and not so good information out there about fertility. And so my goal with this podcast is to help you sort out the truth from the weeds. I want to teach you how to chart your cycle and to reach your family planning goals while also even possibly locating hormonal imbalances and to receive proper treatment. I want to help you get in the best hands that you can with the best doctors that you can to reach optimal reproductive health. So if you're ready to get on this journey with me to learn more about your reproductive system, how it was created, and how it should be working, and the best medicine in order to make it work if it is not, you are in the right place. I pray that this blesses you, so let's get to it. Unfortunately, in today's medical world, if somebody were to go to their regular doctor or an OBGYN and say that they were experiencing really bad PMS symptoms, maybe they were experiencing some irritability or tons of headaches before a period. I actually have a client who suffers from chronic migraines right before and during her period. And the first line of treatment right now is the pill. That's just what's given for women who are suffering from these really bad, unwanted PMS symptoms. When in all reality, and if you've heard any of my other podcast episodes, you will know that the pill is just a Band-Aid. It's not actually getting to the root cause of what is making you or what is causing these headaches, what is making you really irritable before a period, right? There are different things that, there are different ways, better ways to treat these unwanted symptoms rather than just the pill. The pill is just giving you synthetic hormones, synthetic chemicals in your body to stop your reproductive system from working as it should. It inhibits ovulation, which means that it's inhibiting all of those regular healthy hormones from ebbing and flowing as they should throughout your cycle. And so the pill is really not the best option for anything, but let alone PMS symptoms. Also, just to kind of think about it in a logical stance, PMS symptoms oftentimes don't last forever, right? Like they come and go, or they just stay for a few days before your period and then they're relieved. So why is the treatment, the first line of treatment, the pill, why is it something that you take nonstop every single day to treat something that only happens for a few days out of the month, right? That just doesn't compute. That doesn't make a whole lot of sense. So really what we're looking at is what is actually causing those severe PMS symptoms and how can we actually relieve them, get to the bottom of what is causing them, and then actually treat it, right? So you're not actually experiencing those PMS symptoms, but we can get back to a healthy reproductive system where you are ovulating as you should be. Your hormones, your natural hormones are ebbing and flowing as they should be. How do we get back to that good baseline? So oftentimes these PMS symptoms can actually be a sign of low progesterone. That's kind of the first thing that we look at when I do this PMS screening with somebody and they are telling me that, yes, I have this, yes, I have that, and I have it for a week before my period. So a lot of times it's low progesterone. And if we do blood work, we're going to see, yep, it was low progesterone. So before I get into more of how to diagnose and treat, let me talk about what these common symptoms are. So when I do this screening, I usually ask these 10 different symptoms if the client is experiencing any of these. And then if they are, I also ask them to tell me how many days before a period they experience them. And remember too that a period, the first day of your period, is the first day of bright red blood flow. If you're having any days of spotting before a period, let's say 2, 3, 4, 5 days of spotting before a period, I would actually not consider those days part of your period. The first day of your period is first day of bright red blood flow. So if you're experiencing any of these PMS symptoms before the first day of bright red blood flow, I also ask the client, okay, how many days do you experience these symptoms? Okay, so let's actually get into the symptoms now. So these 10 symptoms are what I ask. So headaches, right? Or especially migraines too. And again, when I'm asking these questions, I'm asking, is this specific to right before you have a period? Because then after headaches, the next one is irritability. And I often have clients be like, all the time. But no, I'm actually talking about just right before a period. Like, is it worse? Is it worsened right before a period? So headaches, irritability, fatigue, insomnia, so trouble sleeping at night, crying easily. That's another one that's like, all the time. No. If it's more so right before a period, any signs of depression. So just really a hopeless feeling, can't get out of bed before a period. Any cravings. This is really common for carbohydrate or sugar cravings right before a period. Any noticeable weight gain or bloating, and then breast tenderness. These 10 symptoms are all very common PMS, premenstrual syndrome symptoms. And so again, I also ask, okay, if you're experiencing these symptoms, how many days before a period are you actually experiencing them? And if the client tells me it's like 1, 2, maybe even 3 days before a period, that's less alarming, right? That's more so just, okay, progesterone, which is the hormone that's high in that post-ovulation phase right before a period. Progesterone is starting to drop. Your hormones are just naturally starting to drop in response to, okay, we're getting our next period. So 1 or 2, maybe even 3 days of them are pretty typical. However, if they are severe though, and you're experiencing severe symptoms, even for 1, 2, 3 days, that's still a red flag. And I do encourage you to go see a doctor that won't put you on the pill to relieve those. But if I have a client that tells me 4 or more days before a period, they're experiencing any of these things, or even like a week. So I've even had a client say they have 2 weeks of PMS before they have their next period. That's half their life if they're having like a month-long cycle, right? And that's just not okay. No one deserves that at all. So we want to get that treated. We want to get that fixed. And so those are the 10 main symptoms that I ask for. And oftentimes as well, clients will tell me that they also have severe cramping, or just any cramping, right? Now, some discomfort right before or even during a period is typical because your uterus is contracting in order to expel all of that blood. That used to be the lining of the uterus and is now the period bleeding that you see, right? So uterus contracting, that's not always the most comfortable thing in the world, but if it's ever severe or painful, right? And especially if you're having cramping for multiple days before a period, that's also something that that I encourage you to go see a doctor for as well. Now, one thing I also wanted to note here is that not only is the pill given for PMS symptoms, and I've already explained why that's not a good idea or good medicine, but also too, a lot of women are put on an antidepressant for their PMS symptoms because sometimes, as I mentioned, depression, it can be one of those PMS symptoms. But here's the deal with that. And I, please don't get me wrong, I am not against antidepressants at all. I think they are a very useful tool in some circumstances. I actually have a whole kind of journey with postpartum depression, and I have taken antidepressants in my past, and they have been incredibly helpful. So this is not to say that I am against antidepressants. However, it kind of goes along with what I mentioned with the pill on if you're only experiencing these symptoms for a few days out of the month, why then are we taking a pill to relieve that at all times, right? That just doesn't compute. It doesn't make sense. And so there has to be a better solution for these specific PMS symptoms, or if you're experiencing depression just during the premenstrual syndrome, right before your period. If you're only experiencing it then, I don't think that antidepressants are going to be the best solution, because again, there is a hormonal imbalance going on. So let's treat the hormonal imbalance before we try to add on anything new. Now, another thing as well is that these symptoms can be worsened by your diet. So if you have really, really high sugar intake, especially right before period, that can definitely worsen. And so when we're talking about treatment options, especially if we find out that it's low progesterone that the woman is experiencing that's causing these PMS symptoms, sometimes even just changing your diet can really help alleviate these symptoms. Not a lot of people, though, want to have a lifestyle change because that's the hard way, right? We want a quick and easy fix, especially as Americans, right? If you're an American listening to this, we want a quick and easy fix. But when it comes to health, the better option is not always that quick and easy fix, but it's that lifestyle change. It's making healthier decisions and having healthier habits. And so going on walks when you are in that post ovulation phase, when you're expecting your period to come, being a little bit more active and eating healthier foods, which these two things are like the worst things that we want to do. They're like the least things that we want to do in this time, but that can also really help alleviate these symptoms. However, for some women, doing those things, changing your diet and getting some exercise, that doesn't cut it. They're still experiencing these major PMS symptoms. And that's where we get into, okay, there's a real, truly hormonal imbalance. And let's look at that. So going back to, okay, I'm sitting with a client, we're doing this PMS screening. They're telling me, yes, I'm experiencing 5 of those for a week before my period. Okay, let's talk about that. So normally what I'll do is I'll refer them to the doctor if they're not already seeing the doctor. And the OBGYN clinic that I work at is actually run by doctors who do not prescribe the birth control pill. They also know how to read fertility charts. And so that's actually why I'm employed there, is because I am teaching their clients how to chart their cycle in order to be able to help the doctors diagnose and treat them in a better way. So if I'm seeing these PMS symptoms, oftentimes they're already working with the doctor. Okay, so I will say, all right, let's take a look at your progesterone levels. Let's work with the doctor. Let's get you some blood work and let's see what your progesterone levels are looking like. The issue with doing progesterone blood testing is you have to be able to do it in a timed way, because if you're doing it if you're getting your blood work done from the first day of your period up until ovulation, and ovulation should be around the middle of your cycle, progesterone is naturally low. You actually wouldn't even be able to see it on a blood test because of how low it is. And that's the way it should be. It should be low during that time. Now, post-ovulation, after ovulation happens, and then through the rest of your cycle, progesterone should be high, and it actually should be kind of in a bell curve. So it shouldn't just spike and then drop again, right? It should be in a bell curve for over about 2 weeks. And so it's rising, staying high, and then the day or two before your period, it starts to drop, and that's what kind of signals your next period to come. So when you're getting blood work done for progesterone, it's important that first of all, you're targeting that post-ovulation phase of your cycle, which very often you can't do without charting your cycle. That's why charting your cycle is so important. And so if you want to get blood work done for progesterone, it really needs to be in that post-ovulation phase. Now, a lot of doctors already know that, but then they'll say, okay, just get your blood work done on day 21 of your cycle. Now, the reason that there's an issue with that is because, first of all, not all women have this perfect 28-day cycle. Very rarely do I see a woman, I guess I do work at an OBGYN clinic, so I'm seeing women who are already experiencing issues. So anyways, maybe I'm more biased in that way, but very rarely do I see women who have like this perfect 28-day cycle. And so targeting day 21 isn't always targeting that post-ovulation phase. So for women who have longer cycles, especially, maybe they have 40-day cycles, day 21 is probably haven't even ovulated yet at that point. So progesterone is going to be naturally low on day 21. So that's one of the issues with just picking a random day of the cycle that we assume is in your post-ovulation phase, right? We can't do that when we're trying to test for progesterone. Now, the other issue with that is, in a perfect world, testing progesterone, you would want to actually have 5 to 6 blood tests. Now, I know that's a lot, but let me explain to you why. So remember how I said that progesterone needs to be a bell curve. So it shouldn't just spike and then drop. So let's say that you're only getting your okay, back up. Let's say you have this perfect 28-day cycle, and you are getting your blood work done just on that day 21. Well, that's great. Okay, we know you're in the post-ovulation phase if you do have a normal monthly cycle, but we only know that one day. That does not give us a good enough information to know, are you having that true and healthy bell curve of progesterone? So in a perfect world, if insurance is covering it and everything works out, the client can afford it, right? In a perfect world, you would want to get blood work done on what's called peak +3, +5, +7, +9, and +11. Okay, what does that mean? So when you are charting, we try to locate something called a peak day, and your peak day is going to be our best guess as to when ovulation is happening. And if we can find your peak day, we know hands down, just from research done, we know that ovulation happens 3 days before to 3 days after peak day. So that is our best guess as to when ovulation happens. So if we can find your true peak day on your chart, then we know with most certainty that, okay, yes, you have ovulated, you are in your post-ovulation phase, and so progesterone should rise. So what we do is we ask for blood work to be done on peak +3, meaning 3 days after your peak day, peak +5, which is 5 days after your peak day, and then 7, 9, and 11. And doing this blood work on these 5 days helps give us that bell curve, that or see if you're having that bell curve that you should be having, that a normal, healthy cycling woman should have of this progesterone curve. Now, some women, their insurance doesn't cover that or they can't afford that, and that's totally fine. Usually what the doctor will do at that point is to say, okay, let's do 2 blood tests during your post-ovulation phase, just to get a little more information than just that one blood test. Because just that one blood test, it can be helpful, but it's not nearly as helpful as doing 2 and even up to 5. So that's how we can get a good bell curve understanding of what that bell curve looks like for you. Now, if we're seeing from that blood work that you do have low progesterone, maybe progesterone doesn't rise as high as it should, or maybe it's rising as high as it should, but it's not staying high long enough. Progesterone should stay high for about 2 weeks before your next period post-ovulation. So if there is something going on with progesterone where it's not high enough or it's not staying high long enough, that can be why you are having these PMS symptoms. And especially if they are incredibly severe, in any case, no woman should have these PMS symptoms, right? Especially if they are, if they're interfering with your quality of life, and especially if they're very severe, right? No one wants this. No one deserves that. So if we can see that you have low progesterone, okay, here's the treatment then. So what my OBGYN clinic does, which I think is the best line of treatment for this, if we're starting off with trying to treat that progesterone, is you should be getting a bioidentical progesterone. And this can be taken in 3 different ways. This can be taken orally, it can be taken vaginally, and it can also be taken intramuscularly or through a shot in your muscle. And so oftentimes we just start out orally. If a woman needs more, then we'll move up to vaginally or even for that shot. But we usually just kind of start at orally, depending on how low that progesterone showed on the blood test. Now, if a woman is taking this oral progesterone, here's another kicker. She can't just take it all the time because progesterone shouldn't be high all the time. And this kind of goes for the pill too. Now, in the pill, it's a synthetic progesterone. It's actually called progestin. It's not a bioidentical progesterone. It's very, very bad for the woman's body, and you are taking it at all times. So that's just one of the many issues with taking the pill as a source of medicine to heal something, because it's not healing anything. However, if we can take bioidentical progesterone, which means that it's chemically the same type of progesterone that your body is already producing, and we can target you taking that progesterone only in your post-ovulation phase when progesterone is naturally going to be high. This is going to be the best first line of treatment for those PMS symptoms. If those symptoms are truly being caused by low progesterone, which oftentimes they are, the best way is to start getting a client or a woman charting their cycle so we can pinpoint when that post-ovulation phase is. And then when you start to take progesterone, you'll take it only in that post-ovulation phase. So this is the best first line of treatment for PMS symptoms if diet change is not working, right? That always should be the first line, really, is diet change, lifestyle changes, working out more, moving your body, eating more healthy, less carbs, less sugar, all of that good stuff. But if that's not cutting it, because for some women it just doesn't, this is the best next line of care, is taking this bioidentical progesterone if the woman is having a low progesterone. The pill is not needed. It's never needed. And I have plenty of other podcast episodes explaining exactly how the pill works, why it's horrible for the woman's body, all of that good stuff. But instead, getting off of my soapbox now, the pill is just not the best line of treatment because it's not restoring the woman's body to a true healthy state. It's just covering up the issue. It's stopping her reproductive system from working as it should. And maybe it's relieving the PMS symptoms, sure. But if a woman wants to actually ever get pregnant one day, she's going to have to get off the pill. And then all of those PMS symptoms are going to come back. And oftentimes, too, this goes for really any reproductive issue. If a woman is on the pill for some sort of reproductive issue, that reproductive issue oftentimes gets worse while she is on the pill. So when she gets off one day, those symptoms are going to come back in full force. So we want to actually get to the root cause now of what is going on, heal it now so that you're not having to experience it ever again, right? That is the goal. And that, for any other line of medicine, that is the goal, right? If I come in to the doctor's office with a broken left arm, they're going to want to put a cast on that arm and restore it back to the way it was before, right? As best as they can. But why don't we do that with reproductive health? Why do we always put a Band-Aid on things? Why don't we get to the root cause of what is happening and heal it from the root up, heal it from the ground up? This is proper medicine. This is how we should be treating our clients, is figuring out proper diagnosis of what is going on and then proper treatment, getting to the root cause and healing it from there. So with premenstrual syndrome, PMS, oftentimes it is that low progesterone. So let's fix that low progesterone. Let's do a proper diagnosis, blood work, and let's get to the bottom of it. Bioidentical progesterone targeted in that post-ovulation phase is going to be your best bet for that first line of treatment. So that is what I have for you guys today. Thank you so much for sticking around, and I will talk to you guys again next week.